I always know that I'm going to get a migraine. I look at my hand and it looks like somebody else's hand.
Like most people who suffer from migraine headaches, Michelle Carney's symptoms start gradually and then come on strong.
If I want to look at you, I would have to look over here because my vision is disturbed. I get a lot of black spots and aura. And then I get a bit nausea, I want to vomit, and I have to lie down.
Once the pounding pain sets in, Michelle says lying down is about the only thing she can do.
You wipe that day off, you go to bed, you suffer.
But now, Michelle hasn't had to suffer with a migraine headache for more than 3 months now. In fact, she hasn't had any kind of headache since she began an experimental anti-wrinkle treatment called Botox. Botox is made from a diluted form of the bacteria that causes botulism. A few years ago, doctors began using it to treat muscle spasms in the face.
Just a teeny little bit.
Then cosmetic surgeons began using Botox to reduce worry lines on the forehead and crow's feet around the eyes.
Make a surprise face.
Now, a startling discovery that Botox may provide relief from migraines by preventing them in the first place.
I made the observation that it actually had reduced or eliminated, in some cases, generalized headaches, and then we found that it specifically had an inhibition to migraine headaches.
Plastic surgeon Dr. William Binder is the man behind the research. His preliminary study of 96 patients found that in more than half, Botox eliminated migraines.
They get relief for approximately 3 to 4 months. The best drug out there right now is 3 to 4 hours.
Dr. Binder just presented his findings to the American Academy of Cosmetic Surgery, and now larger studies at UCLA and in 2 other cities are underway.
Each one sort of validated on their own, with their own observations, the original findings.
Add to those studies Michelle Carney, who's not one of Dr. Binder's patients. She made the connection on her own.
I had the Botox originally because I do have a lot of frown lines and I use my face a lot. So I thought, well, I'll try that for the wrinkles.
When her headaches went away, she wasn't sure what to think until she heard about Dr. Binder's findings.
Botox for migraine. I knew that. I knew that.
Michelle and Dr. Binder say what really makes the discovery so exciting is that in trials, Botox appears to be very safe.
This is a real phenomenon because it's a local injection that is not a systemic drug, so you have no systemic side effects.
I wouldn't take something every day. I would rather suffer the migraine. But if I could have something like Botox, it would be a miracle. And I wouldn't get any wrinkles on my forehead. That would be fantastic.